New science from the Campaign to End Loneliness found that over a decade of someone's life, loneliness could cost the NHS and other health services around £6,000 per person thanks to the related health issues. Clearly, something needs to be done. Loneliness in today's world, digitally more social than ever, is an even bigger problem than the mounting obesity crisis. MH Investigates. The Office of National Statistics recently found the UK to be the loneliest country in Europe. Obesity is often spoken of as the plague of our age. But a new study has found that loneliness is more prevalent and deadlier and is something far more of us are expected to experience in our lives, often without realizing it's happening. The study of social isolation and loneliness was carried out by Brigham Young University, Utah, and found that while obesity increased risk of death by 30%, loneliness increased it by half. Related how team sports can give loneliness a kicking. A study in blues. Leading the study was Dr. Julianne Holt-Lindstad, professor of psychology at the university. She said, being connected to others socially is widely considered a fundamental human need, crucial to both well-being and survival. Extreme examples show infants in custodial care who lack human contact fail to thrive and often die, and indeed, social isolation or solitary confinement has been used as a form of punishment. Related 7 ways to outrun the blues. An increasing portion of the Western population now experiences isolation regularly, she says. It is important to point out the difference between merely not being around people or me time, and the experience of chronic loneliness. It is in the latter that the problem lies. Mind over matter. Feelings of loneliness initially cause people to feel worse mentally and to significantly affect happiness levels. This is then seen to have a detrimental effect on physical health. Those who are lonely are no more likely to get ill but will suffer far worse symptoms and slower recovery times than those who are identified as not lonely. A study by Grants at the Social Network for the Over 50s recently found that 75% of UK retirees describe themselves as lonely, and most do not feel they have someone they can talk to about their concerns. Related have scientists just made a mental health breakthrough. Lonely in a crowd. What also needs to be made clear is the difference between isolation and loneliness. Of those in the Grantset study who did have social connections, 70% said the family and friends would be surprised to discover that they felt lonely. The Office of National Statistics recently found the UK to be the loneliest country in Europe. To quantify that, it costs £26 million each year in loss of earnings due to illness exacerbated by loneliness. GPs have said many cases they view are made worse by loneliness and can be remedied by initial, non-P, face-to-face social and talking care. Dr. Holt-Lindstad said there is robust evidence that social isolation and loneliness significantly increase risk for premature mortality, and the magnitude of the risk exceeds that of many leading health indicators. With an increasing aging population, the effect on public health is only anticipated to increase. Indeed, many nations around the world now suggest we're facing a loneliness epidemic. The challenge we face now is what can be done about it. Related Marcus Trescothick opens up about mental health.